to finish up what I've started. And if I don't get to finish everything today, I will certainly put it on my YouTube channel, as I want to ensure that I'm able to touch on the health topics for this month. So we're continuing on thyroid. Last week, I ended going over how you can check your thyroid at home by holding a mirror, tilting your head back, taking a sip of water, swallow, and watch for any signs of bulging. So let's talk about the labs. I've also touched on the labs that are checked. So when you have hypothyroidism, the levels, low T4 level, high TSH level. Hyperthyroidism, high T4 level, low TSH level. And these are the markers, and these are what the numbers usually are. So for the marker for TSH, the normal range is 0.4 to 4.0. The total T4 is 5.4 to 11.5, and the free T4 is 0.7 to 1.8. The reason why I go over these labs, nowadays a lot of us have our electronic records on our phones. So you can look at these numbers for yourself and see if you have any questions that you may want to ask your provider if these numbers are out of range for you. Again, as I disclosed, when you have the hyperthyroidism and the hypothyroidism, what the levels are and how those numbers flow, if they're high or too low. So let's talk about medications that interfere with thyroid function tests. There are many medications that can affect thyroid function testing. Some common examples are estrogens, such as birth control pills. So if you know that you're going to have your labs done, it's better for you to stop these or make sure that your doctor knows that you are taking them. Biotin, which is commonly taken over-the-counter supplement, can cause the measurement of several thyroid function tests to appear abnormal when they are in fact normal in the blood. So biotin should not be taken for 2 days before your blood is being drawn. Treatment options. Treatment depends on the problem, how severe it is, and what your symptoms are. Possible treatments may include medicines, radioiodine therapy, or thyroid surgery, and that is the extreme. If you have high levels of thyroid hormones, called hyperthyroidism, treatment options can include anti-thyroid drugs. These are medications that stop your thyroid from making more hormones. Radioactive iodine and beta blockers. Now, the beta blockers, these medications don't change the amount of hormones in your body, but they help manage your symptoms. Other treatment options, surgery. A more permanent form of treatment for healthcare provider may surgically remove your thyroid. This will stop it from creating hormones. However, you will need to take thyroid replacement hormones for the rest of your life. If you have low levels of thyroid, called hypothyroidism, the main treatment option is thyroid replacement medication. This drug is synthetic, man-made way to add thyroid hormones back into your body. One drug that's commonly used is called levothyroxine. By using a medication, you can manage thyroid disease and live a normal life. The do's and don'ts if you're taking thyroid medication. You want to take thyroid hormone replacement medication as directed by your doctor, generally with an empty stomach. It's also important to know that too much dietary fiber can impair the absorption of thyroid hormones replacement medication. Certain food supplements and medications can have the same effect. Avoid taking your thyroid hormone at the same time as walnuts, soybean flour, cottonseed meal, different supplements, including your iron, your multivitamin, or anything that is containing iron, calcium supplements, your antacids, just to name a few. Supplements containing biotin, which we already spoke about earlier. Is there any truth to people having special food that you can't eat, or can certain foods increase your thyroid function? Generally, there's no hypothyroidism diet, although claims about hypothyroidism diets abound. There's no evidence that eating or avoiding certain foods will improve thyroid function in people with hypothyroidism. However, adequate dietary iodine is essential for normal thyroid function, as well as eating a clean, balanced diet. Some encourage avoiding what's called cruciferous vegetables. And those are like your turnips, your cabbage, bamboo shoots, bok choy, broccoli, Brussels sprouts, cassava, cauliflower, collard greens, kale, mustard, and rutabaga, as they can block thyroid hormone production. Maintain healthy body weight, as overweight people need more thyroid hormones as well. Foods to eat if you have hyperthyroidism. The mineral iodine plays a key role in making thyroid hormones. A low iodine diet helps to reduce thyroid hormones. Add these foods to your daily diet. A non-iodized salt, coffee or tea without milk or dairy. Now, if you're someone that's getting anxious and nervous and get very shaky, don't consume the caffeine, because that may just make it worse. Egg whites, fresh or canned fruits, unsalted nuts and nut butters, homemade bread or breads made without salt, dairy, and eggs, popcorn with non-iodized salt, oats, potatoes, honey, and maple syrup. Foods to avoid if you have hyperthyroidism again: excess iodine. A lot of us love fish, especially when you're from the islands. Shellfish, crabs, lobsters, sushi, nori, kelp. Avoid all the foods that are high in iodine, such as milk and dairy. Not too much cheese, iodized salt, and iodized water, and food colorings. Gluten. In some people, gluten may harm the thyroid by causing inflammation. Even if you don't have a gluten allergy or intolerance, it may be beneficial to restrict or limit gluten. Check food labels, that's important, for gluten-containing ingredients such as the wheat, barley, brewer's yeast, malt, rye, and triticale. Foods and beverages that contain caffeine, I spoke about that early, can exacerbate some symptoms, especially if you're someone that gets anxious, nervous, gets irritable, and gets a rapid heart rate. Life with thyroid disease. Thyroid disease is treated by an endocrinologist. That's who would check and diagnose you finally. Surgery, if it's needed, is performed by a general surgeon or an otolaryngologist or ENT. If you have a total thyroidectomy, you will take lifelong thyroid hormone replacements because your entire thyroid gland is removed. It will no longer supply you with the hormone you need to control your body's metabolic processes. You might also have to take supplements after thyroidectomy to balance your calcium level. In general, people have a good quality of life. Ask your physician about doing moderate exercise and when you can start doing that. Again, maintain a healthy body weight and find ways to manage your stress. Sleeping, resting is key to help regulate the stress hormones, cortisol, in your body. These are just some numbers that I found, that 8 of hypothyroidism is a good 8 out of maybe 1,000 people, but it's a high number. Like, you want to look like 5 to 10 times more common in women. So ladies, please be mindful of that. You want to make sure that you're getting your thyroids checked. I actually just had mine checked this week. Thank God it's good. It is good. But you want to make sure that when you're getting labs done, you ask for some of these things. So when I'm doing these sessions and I'm mentioning certain labs, be proactive in asking your physicians to check them for you. Some takeaways I want you to have today, especially when it comes to hyperthyroidism. Hyperthyroidism may not always be preventable, but it is treatable. See your doctor if you have any of the symptoms of hyperthyroidism. Follow your treatment exactly as prescribed, including all dietary recommendations, and your physician may want to ask you to follow up with a dietitian. Talk with your doctor or dietitian about making short-term or long-term changes to your diet. This can help balance thyroid function and protect your body from the effects of hyperthyroidism. Enjoy home-cooked whole foods on a low iodine diet. Avoid restaurant, box, or processed meals because those meals also have a lot of sodium in them. And prepared sauces and marinades, they may contain added iodine. If you're on a low iodine diet, it can be more difficult to get enough vitamin D and calcium. Talk to your doctor or dietitian about taking supplements with these nutrients. Seek support from thyroid support groups. Most dietary restrictions will be temporary, or their dietary changes are part of a healthy, balanced lifestyle for better overall health and wellness. Support groups that are available. You have the Endocrine Society, you have the American Thyroid Association, meetup.com, GTAFT, GTATF.org, British Thyroid Foundation, and Thyroid Foundation of Canada. And these can be accessed online by anyone from any place. I want to give special acknowledgement to Johns Hopkins Medical Center, the thyroidawareness.com line, agingcare.com, healthandaging.org, care and treatment, thyroid.org, the Mayo Clinic, and the Cleveland Clinic for the information that I provided you on this topic. Thank you so much for your time, for your patience. I hope this was helpful. You can feel free to join me in the Zoom room for any questions you may have on this topic, and I'll be happy to answer them for you. God bless and enjoy the rest of the service.